lessons around how people communicate innovation that I will talk about very quickly. And then I've got a very quick example of some stuff that we did with the Vanguard in South Somerset, which Gail just mentioned. So I actually spent the first 8 years of my life in healthcare buried away as a data analyst at the top of a tower in North London, and didn't really understand the communications world. We had a communications department. I gave them stuff and it kind of got out there and stuff. And then I kind of stumbled into communications about 8 years ago when I became interested in the fact that the medical profession in particular had lots and lots of information about what was going on in our hospitals, and in the main this wasn't being shared with patients and the public, and I became interested in how we might share complicated data with patients and the public and move action. So was involved in initiatives like how do you publish very complex things like risk-adjusted mortality rates in a way that patients and the public might understand them, but doesn't in fact create fear. And I stumbled along and have eventually ended up at ZPB. Nice to see some friends in the room. We're a consultancy, as Gail says, that helps lots of organisations have a conversation with the NHS. That started off being private sector organisations, but it's now, we work with public sector organisations in the room as well. And it's all about, as I said, having conversations with the NHS. That could be very transactional conversations. Lots of people we work with just want to sell more of their products, and we help them do that. And there's some lessons around there. And I know a lot of the innovators in the room is about developing some kind of product or services that you might want to, in the lowest common denominator, sell into NHS organisations. And there's ways I'll talk about doing that. But also a lot of it, it's about how do you change the conversation. How do you have an NHS, which is constrained by the fact that they haven't got any money and that waiting times are going through the roof and that finances are a problem? How do you have these kind of longer-term transformation conversations that everyone says we need to have, but also, in my experience, aren't going on? So we can talk about a bit more of that in the Q&A, and I'll come on to that in the example. But I've just got kind of a few lessons that I was going to talk about, which I think builds on Gail's principles. And the first thing I'd say is that this is the time to do it. We are absolutely in the information age. There's 1,000 different channels. There's 1,000 different ways. I love technology. As people that know me, I think technology is the key to how we're going to fix the problems in the NHS, but it's also the key to communicating. 10 years ago, we had almost none of these channels, and there was only really 2 ways to communicate, and they were really badged as news and PR. And the old adage was news was information you didn't want people to know, and PR was information you were desperate for people to know. And the trick for people like me 10, 12 years ago was to get a PR story and try and turn it into news. And that was how you communicated to people. You had national newspapers, you had local newspapers. That was pretty much it. So absolutely embrace every channel you can. And as Gail said, it's about thinking about your audience, and I'll come a bit more onto that. Secondly, think about what you're communicating. Very much this is the niche and the space in which ZPB works, but have some data, have some information, have something to communicate. The graph that's still there, as you said, it's not the be-all and end-all, but it's fantastic that you can actually show that well-being scores improved. So at the outset, if you think you're going to do a communication plan, think about collecting data and think about what you want to collect. We ran, for example, a communications campaign a few years ago for a very big, very boring outsourcer who wanted to change the narrative in the way in which they delivered services. So they were being paid quite happily, could have continued on process measures by the hospitals. So they were paid if they changed the beds 3 times a day and washed the sheets and all that kind of thing. What they wanted to be paid about was outcomes, so whether the people that they were looking after were getting hospital-acquired infection, which, as many of you will remember, was rife at the time. So we ran a whole communications campaign where we looked at every hospital in the country, we looked at how much they were paying for their cleaning services, and we were looking at how good their outcomes were. And what we found, and actually some of our clients were in the wrong bracket but could renegotiate their contract, was some of the people paying the highest amount of money had the worst outcomes, and some of the people paying the lowest amount of money had the best outcomes. So it was about putting together a campaign that was evidence-based, which changed the conversation. So I think definitely think about what you're going to communicate. Thirdly, exactly as Gail said, it's about thinking about the messaging. A lot of the work we do, we like to communicate in a way that patients and the public could understand it if they got hold of the campaign, even if it's aimed at what we call B2B. So that would be even if it's kind of professionals talking to NHS clinicians. But we don't want to close shop, so do communicate in a way in which patients can understand it. I saw it, a slight aside, but there was a brilliant thing where I saw NHS England was tendering for a supplier to build the NHS as a social movement, which seemed to me absolutely counterintuitively, because social movements are something that obviously should be ground up and lived. But I don't think we're ever at a point yet where patients are going to demand a product, but if patients understand what you're doing, if they can talk to their GP about it, it's going to have recognition. So, we want a situation where people are saying to their GP practices, it is unacceptable that I have to hang on the phone at an 0845 number for 30 minutes to get an appointment. Why can't I book my appointment online? And if you can explain those messages, it will kind of absolutely help. And also, in terms of messaging and audience, it's about being different. A chair of ASCCG not too far from me told me about this time last year he was getting 30 emails a week into his inbox which was saying, buy my product X and you can meet your commitments in the 5-year forward view. And he showed me them, and every kind of subject line was, innovation in healthcare. Strapline is, the NHS is financially challenged. Please buy my product, you'll meet all your requirements. And that was everything from kind of a new way to do GP rostering to kind of technologies, online booking, etc. So think about your message, think about doing it differently. As one of the colleagues said earlier, face-to-face is as important as kind of just spamming people's inbox. Start to think about, what's the channel? If you're talking to young people, it's about Snapchat, it's about WhatsApp, etc., etc., etc. I find it brilliant that two things I find brilliant that the NHS is doing on communication. First of all, we're just starting to use SMS messaging now, when most phone companies are about to turn SMS messaging off. Suddenly everyone's panicking. Suddenly everyone's saying SMS messaging is safe. I hate to think what would happen if we said to a Caldecott Guardian, can we use WhatsApp please to tell someone the time of their clinic and stuff. But think about channels. I always do this when I talk in this area. Put your hand up if you've had your mobile phone number longer than you've had your address. So I think that's pretty much everyone in the room. Yet the NHS's default position is post. That is the only thing, Dean, that we're allowed to kind of communicate with. And every other channel, there's a bit of a risk. And someone explained it, I was puzzled by this, someone explained it to me. It's because in 1948, when the NHS was founded, there was only one way of communicating, and that was post. And no one said to Bevan, can you get, the government's can you get the Fiona Caldecott of the time to kind of tell us post is safe? Now, I don't know, I think it's very hard to send an SMS message to the wrong number, but mail goes all the time. So we have to have these kind of communications with the people we work with to say we've got to communicate with the best channel and we've got to kind of do the safety. I've had the 2-minute warning, so I'm going to just quickly wrap up, and I won't do my slides, but I can come back to another thing. I think the fourth one I'd say is absolutely kind of be fearless, be prepared to get your message out there. The kind of tech SMEs we work with almost always ask me the same question. They say, I'm really worried, I've got a meeting with a clinical director, but we haven't yet got a randomised control trial. We can't prove what we do is effective in the way that it has with a medication. So should we go and have that conversation? Not dissing randomised control trials and academic research, but I think the dialogue is changing. There's Patients Like Me, which is a website in America, which some of you might have seen, have proved that collecting data from patients absolutely correlates with randomized control trials in the idea of side effects of drugs. So they would ask patients to report on drugs. They would find out that a drug for, say, asthma or whatever also were making people drowsy. And the weight of the patient voice said, we're pretty sure the side effect of this drug is drowsy. 18 months later, the randomized control trial came out and said, this drug makes people drowsy. So don't be afraid of communicating. If you've got the data I mentioned, get out and communicate it. Academic research, as I said, is often important as well, but if you can make some nice graphs like this, infographics, etc., are even better. Don't kind of think, I'm going to launch my project, I'm going to stay quiet for 2 years, then I'm going to communicate the kind of evaluated results. Do it all the time and start your conversations. And the example I was going to show was the work we did in the Vanguard with Yeovil, where they said, I think everyone knows the Vanguard, so 5-year forward view came out about nearly 2 years ago now. The Vanguards were putting lots of money to kind of be the exemplars, the trailblazers, and then, you know, everyone from The Guardian to kind of people in Skipton House down the road were ringing them up and saying, well, what have you achieved? How have you spent the $500,000 we gave you? And the campaign we ran with Yeovil was a public-facing dialogue through a series of blogs and websites to be able to show everyone from the national press to NHS England what they wanted to do and how they were starting to achieve without having to wait for kind of the absolutely crystal evidence-based data that was going to take us 2 years to collect. So have a conversation, keep your message, look at the stuff GDS, the government website, have been doing. They're the experts in this, communicating all the time. And then finally, you're not on your own, seek help. So the great thing for innovators, I'm going to put my friend Tara on the spot here, but we have organisations like Academic Health Science Networks who are all over England who have specific skills around helping innovators get their message right and get it communicated. Go and talk to your local AHSN, they'll help. There's lots of organisations like myself. One of the best things about, I think, working about with Guys and Tommy's charity, and they've funded a project for us last year and hopefully going to do one next year, is you've got people like Gail and the team who will give you advice as well as just kind of giving you a load of cash and then walking off. Talk to other organisations, come to events like this and seek help to do it. But I think really my message is, Gail said right at the beginning, communications is either an add-on or there's a bit of fear about it. So don't be afraid at all, and don't make it an add-on, make it absolutely central to your project, because that's how you'll get your innovation to spread.